Lisa Premier Hospital is a multi-specialty center. It was founded by Dr. Ibrahim Wada, an IVF specialist, an obstetrician and gynecologist, in 1996. Then it was just a 3-bedroom IVF center somewhere in Gwagwalada, Abuja. Currently it has grown to more than 130-bedded multi-specialty center. It has also grown from just offering the IVF services to also include pediatric and neonatology services and other multi-specialty areas like the cardiology, the orthopedics, neurosurgery. In the operations of the hospital, appropriate laboratory management is very pivotal to the functions and the health of the system. You can't underestimate the function the laboratory plays because patients are here to access care, and majority of the decisions the doctors take depend on the quality of results you get from this processing.
There are some operational challenges with laboratory management. Of course, you have to deal with the present economic situation of the country and also manage the limited resources available for you to run the lab. Here in our facility, we run a multi-specialty laboratory comprising of the clinical chemistry, the hematology, the microbiology, and histology. We analyze samples from the various clinical departments, and all these samples come to the central lab. Also, we have a side lab for pediatrics departments that helps in prompt running of test results.
The turnaround time is being reduced from 2 hours to less than 30 minutes, thereby making it very fast for doctors to get their results and start treating the patient immediately. Also increasing patient satisfaction. Also, number 2, we reduce handling errors when we test directly here, because previously, before the POCT machine came to us, we could have handling errors like misplacement of samples, bottles could fall down and break. Do it here directly, those errors are greatly minimized.
In pediatrics, there's a peculiarity of having to deal with your patients and anxious parents. And these parents want prompt treatment and they want it done, accordingly. I would like to share about a 18-month-old male infant who had features in keeping with septic arthritis. And for him, C-reactive protein helped us for both diagnosis and monitoring. So diagnosis, we have an elevated C-reactive level, and with response to therapy, we saw a declining level of C-reactive protein. So we didn't necessarily have to involve the surgeons for any form of invasive procedure. Having to get the tiniest blood sample to make a diagnosis is a welcome development. We have anxious parents that put up a resistance. So the resistance is less when you tell them you're only going to get less than 10 microliters from just a simple capillary prick, either from the finger or the heel. So it helps make the work easy.
Lisa Premier Hospital is the first hospital to acquire the FS205 technology in Nigeria. And this technology has helped us to greatly improve on our test turnaround time. Because before now we are using a smaller POCT device. It has helped us reduce our turnaround time because now we can actually get samples and they analyze within 20 minutes, which is against the 2 hours turnaround time we are doing before now.
Here in the pediatric side laboratory, we have FS114. It's a portable immunoassay device which we use for emergency CRP and PCT samples, okay? It has an built-in battery that makes it more portable and convenient for use. It delivers a very fast and high accuracy test results. And so the major emergency tests we do here in pediatric side lab are full blood count, malaria parasites, the procalcitonin and CRP. With these results, doctors can quickly start treating the patients, thereby increasing patient outcome and also in turn increasing revenue to the hospital.
Point of care testing is one aspect of medical practice that has greatly helped in delivering optimal health services. You cannot forget that the patient is the reason why the hospital exists. So we practice a patient-centered care aimed at reducing the hospital stay. We focus on reduced turnaround time so that we can get the results you need in managing your patients. By so doing, the patient is happy and the doctor is happy as well.